Good evening. We can start our briefing for today. We're here to give you an update from the National Emergency Response Committee on Coronavirus, and the update stands as 5th April 2020. Fellow Kenyans, we apologize for this late briefing on the current status of coronavirus in the country, and we request you to kindly bear with us. Dear Kenyans, in the last 24 hours, we have tested a total of 530 samples, out of which 16 people have tested positive for coronavirus disease. Out of this number, 15 are Kenyans and 1 Nigerian national. Out of this number, 11 have got a history of travel, while 5 are locally transmitted. This now brings the total number of those who have tested positive for the disease in the country to 138. Out of this number, 9 are from the quarantine facilities, while 7 are from contact tracing. The 16 people have already been moved into isolation in various health facilities, and contact tracing is ongoing. To date, we have managed to test 3,836 samples from individuals. The distribution of these new cases, according to their counties, is as follows: Nairobi, 12, Mombasa, 3, Kilifi, 1. In terms of gender, 9 are males and 7 are females. The ages of the confirmed cases range from 22 to 66 years. We have so far monitored 1,833 contacts, and out of this number, 1,384 have been discharged. Currently, there are 449 contacts that we are actively tracing. We want to reiterate that persons who pass away due to coronavirus will have to be buried within 24 hours from the time of death, and the burials are restricted to less than 15 close family members. I would like to take this opportunity once again to acknowledge and appreciate the continued cooperation and collaboration that we have with county governments, especially those who have confirmed COVID-19 cases, and urge the rest of the counties to continue upscaling the level of preparedness and vigilance. As we mentioned yesterday, we would like to reiterate that all persons visiting public places such as supermarkets, open-air markets, public transport should at all times wear a face mask to reduce the chances of transmission of this virus. The production of face masks and other healthcare-related equipment is ongoing locally. The distribution of the masks will be done at the county level through various organized groups such as the Matatu Circles. Meanwhile, I urge you to continue to acquire masks as we await for the government distribution. Fellow Kenyans, it has also come to our attention that there are private hospitals who are overcharging Kenyans and taking opportunity of this pandemic. We have reports of gloves and other PPE equipment that are costing about 8,000 Kenya shillings for Kenyans who are admitted in facilities. This is unacceptable and immoral, and the Medical Council has been directed to take up this issue. At this juncture, I'd like to invite the Cabinet Secretary of Transport to give you further updates.
Thank you very much, CAS Dr. Mercy Mwangangi. Fellow Kenyans, as you may recall, the government suspended international flights for a period of 2 weeks from Wednesday, 25th March 2020, which expires today at midnight. After serious consideration of the situation, the government has extended the ban for another 30 days with effect from tomorrow, 6th April 2020. This suspension will not, however, apply to those flights that are coming in to evacuate foreign nationals from the country. It also exempts cargo flights that are coming to the country to deliver goods. They must not, however, have passengers on board. And for these evacuations, let me emphasize one thing. We do not want just to have flights landing at Jomo Kenyatta Airport, we require, as a very firm requirement, that whoever is coming must give us 72 hours notice. So if you have any plans to evacuate your nationals, you must plan, you must give us advance notice of 72 hours at the very least. The issue about cargo flights is very important because you are aware we are very, very, very keen to import and to supply our local facilities with medical supplies and medical equipment. So we require these cargo flights to keep on coming to our country. In fact, as we are talking, we are already planning for Kenya Airways to fly on Wednesday to China to basically collect some key equipment, medical equipment, which will come to help us in the interventions which we have right now. Fellow Kenyans, we are appealing to those in the transport industry to adhere to the directives issued by the Ministry of Health with regard to maintaining hygiene standards in the transport sector. We did say earlier when we started communicating with the Kenyans and you, the press, that the transport sector is key in terms of transmission. We did say that 90% of our fellow Kenyans, they do use public transport. So this area is critically important if you are going to address the issue of making sure we don't have further transmission of the virus. To this end, we have observed that the said directives are not strictly being adhered to. For example, most matatus are still overloading, hence not observing social distancing. They are also not observing standards of hygiene as per the set standards. Therefore, we have made this decision. From tomorrow, Monday, 6th April 2020, any matatu operator found not observing the set directives will have their SACCO licenses suspended and the vehicle bonded. This directive applies to all public transport vehicles. The offenders will also be charged in a court of law in line with the Public Health Act for deliberately spreading the virus. And to the border riders who continue to float the directives already issued, their motorcycles will be impounded and they will face the full force of the law. And for this one, we are working together with the Minister of Interior. The police have been briefed accordingly, and there will be no exemption. We know last time we made this announcement, and the same day you could see borders carrying 3 people. This must be understood very clearly, that from tomorrow, whoever flouts these regulations will have themselves to blame in terms of being locked up by the police and in terms of the vehicles, their equipment being impounded. Finally, the government has also directed that visits to our prisons shall remain suspended for another 30 days. I thank you for your attention.
Acute respiratory infections, because that's how, like that. And I went to the ground and they don't know. They are treating ARIs the same way they would treat any disease. So does the Ministry of Health still stand with that thing that county hospitals are helped? Because as it is now, they're the weak link in your work. Thank you.
More questions?